Good afternoon, everybody, and welcome to the latest episode of Shortee Say What? I am Dr. Tracee, and I'm here not just to give you a tip about burns and hidradenitis and all things traumatic skin. I am super excited because in trying to find the best that we can serve the community, I have found I didn't even know I was looking for the answer to this prayer, but I have with me Shadae from Svelte Wigs, and we crossed paths at a business conference where she was talking about how she crafts medical wigs. And I was like, say what now? So as I was listening to her and was engaging and she was talking about her business, like the first thing on my mind was how many burn patients I know who still suffer from thin hair or they're wearing wigs because they had some alopecia spots from scarring or over harvesting of the donor sites, and the ability to have freedom and flexibility in hair. But here's the kicker: she helps it to be covered as if it was like a medical device. Welcome, Shadae. Please introduce yourself and tell us a little bit more about Svelte Wigs.
Okay, well, thank you so much for having me. This is amazing. I'm Shadae Renee, and I specialize in basically being the cure to everything you can think about for hair loss, but due to a medical condition. So we
Okay.
have a wig store in Atlanta, and at that wig store, we had been on a mission to get more people exposed to the medical wig industry. It's called cranial prosthesis. I'm a cranial prosthesis specialist, and you can basically get your hair extensions covered through your insurance as long as you have an experience with medical hair loss. That can be
Okay.
from alopecia, cancer, lupus, and a lot of people don't know about it.
Yeah, I mean, I did not realize that this was something that we could potentially get insurance to cover. So tell us a little bit more. So for people like me, who not the survivors themselves, but the
Mhm.
people who encounter alopecia patients, burn survivors, you name it, but we're on the practitioner side. So they came to
Mhm.
us for a visit. We helped them through that trauma. I don't know if many of us know a lot about wigs. So help me
Mhm.
understand the difference between like a wig, like the regular lace fronts that we know about,
Mhm.
and about your cranial prosthetics.
So I would consider a cosmetic wig the same as a medical. And I'm going to say that because it's all just hair extensions, right? The thing is, if someone has experienced hair loss due to the medical, so cancer with the chemotherapy, that's something that's going to lead to hair loss more than likely. That
Right.
can be a prescription for the cancer can be written to the client, and they can basically use it as a prosthetic with insurance and get it covered. So I
Mm.
like to consider or give this example for my clients, and it would be if you broke your leg and you needed crutches, the doctor's office isn't going to have the crutches. If you've ever been on crutches, there's like a certain height it has to be so you're comfortable. You
Right.
depend on it, and you would need to go to a specialist in that area to get you the right crutch. So think of cranial prosthetics as your prosthetic for your head. Uh-huh.
Nice. That makes sense. It's like needing
Yes.
crutches
Yes.
or a cane. It allows you to be able to return to your usual functions in
Yes.
spite of what that current disability may be.
Yes, and then as far as the types of wigs, there are all types of wigs. We have the full lace where you're covering your hair from your forehead to your nape, and then sometimes you might just need a topper piece in case you're experiencing androgen alopecia, where it's like a male pattern, female pattern baldness, just right at the crown of your head. So when you're thinking about different forms of alopecia, there's a chance that it will grow back. I've had clients that their hair grew back. And this was just a temporary solution.
Mm.
But they're just trying to feel like normal again. And that's where I would come in at.
Oh, that's awesome.
Mm-hmm.
That totally makes sense. Now,
Mm-hmm.
one of the things that, and I don't know if this plays a role with the cranial prosthetics, but I was
Mm-hmm.
totally blown away by the idea that you do custom wigs.
Yes, so we do offer a custom experience where you can come into our store and try on and see color against your skin tones or textures against your skin tones. So that's the try on in-store experience. And from there, we can combine what you've seen and create you something special just for you. And for all of the people that have like extremely small heads, even down to children's heads, we can make a children's wig, because we actually make the wigs on a sewing machine. So I would consider myself a wig seamstress as well.
Okay, okay, singer. We're making more than just the bags and home ec. We're making custom wigs.
Yes, yes,
Oh, I love
yes,
it. And I like that you touched on because they're custom, you can even get them covered for kids. Because I
yes.
think we forget, kids are cruel. Like the time that the kids are growing
Mm-hmm.
up in right now, when you're different from
Mm-hmm.
whatever reason, it can be hard to adjust to going back to school.
Yeah,
And I've had many a kid where I was writing school excuses because they didn't feel ready to go back to school yet. And this is one of those things that we can kind of help move past that barrier to get them back to
yes.
school and work and things like that.
Yes, and kids, I mean, I have a 5-year-old, and let me tell you, they are very opinionated. So when you think about your hair loss, if you're a child, it's a huge deal. So definitely being able to tailor their wigs to look as realistic as possible with the different textures, ponytails, and things that kids might need. This is something that's important and a reason why we offer custom, because every wig is not the same. It should be custom to the person. And I feel like that's what sets us aside from other wig companies that might be affiliated with hospitals or stores when they have one type of wig, synthetic. Well, everyone doesn't want a synthetic wig. Some people might want something with a little bit more texture, something that they can put heat on just like their real hair. They don't want to feel different.
Right.
And so you think about the experience that we're offering, it's amazing.
That is. So you mentioned you were in Atlanta, and I know
Mhm.
everyone that we're talking to is not in Atlanta. So we do have some good news. The idea and the awareness, um, if we go from the standpoint of yes, we want the patients and the clients to be aware that this is an option, but I want to take it a step further, Shade. I really wanted us to be able to offer it from the beginning and not have our patients feeling like it's hopeless or they're lonely or they don't feel
Mhm.
like themselves. And so you will be accompanying me to the Southern Region Burn Conference next week,
Yeah.
where we get a chance to now integrate and interact with nurses and therapists from burn centers across the country, bringing that awareness. So I'm super excited because we'll be in Charleston, was it the 30th through the 1st?
Yep, yep, yep. I'm
Yeah, super
excited.
excited. So, for any therapists, whether occupational or physical, or any nurses or case managers, child life experts, anyone who's going to be in Charleston at Southern Region, stop by booth 10, which is where we will be. She'll have a couple of demos and we'll really kind of walk through the process of how does this even work? Right. And
Yes.
so that's the piece that I'm looking forward to because I never want the first time a doc or nurse is hearing about this as a concept is from the patient themselves, right?
Yes.
Because how can we help if we don't even know and we're not
Mhm.
aware? So I'm looking forward to being able to just kind of drop some knowledge so that we can at least make people informed.
Yes, I am too. And I think it's important because I have women who come in and they don't even know that this is an option for them. So now when I explain to them, hey, I'm a cranial prosthesis specialist and this is what you need to do, now they're doing what? Signing up to go to their doctor and tell them, like, hey, you need to put me a prescription for this and this is what I'm trying to do. When honestly, the doctor is the one that should just let them know what their options are up front, and then we can get them what they need through the insurance that they're already paying for. So it's a
Right.
win-win on everyone's table.
That's amazing. So you're like the specialist of wig makers or the specialist of cosmetologists or aestheticians. Like you are
Yes.
that guru, right?
Yes, I would consider myself a leader in the field, and I hope that this inspires a lot of people to get the knowledge they need so that their clients and the doctors and everyone can get on the same page.
Okay. Now, for those who can't make it to Charleston for the regional conference, and for those who are not able to come to Atlanta, is this something where I do know that we're going to be holding a webinar and we're going to talk to the providers. So this time we're
Hmm.
talking to you. If you are the
Yes.
doctor, nurse, therapist, we're talking to you and we're going to be providing that education. I think the
Mhm.
easiest thing is since you found us at Shortee Say What, the best way that you can find us is going to be at beyondtheor.com/body image because
Mhm.
this is about getting that body image back, reclaiming who you were before whatever diagnosis stripped that hair from you.
Mhm.
And so for the providers, definitely tune in. If you're not able to meet us in Charleston, we're going to do some additional online trainings. Shadae is like, I'm here for it. I want to train all the people so we can get all the
Yes,
wigs made to cover
of
all the
course.
heads.
Yes, yes, yes. And it's really a great thing to offer. And you should see the clients when they come in and they're like so confused, but they leave out looking amazing, feeling amazing. I've even cut someone's last ponytail because they were going through chemo and, they were just losing their hair. So it's an emotional journey, but so rewarding. So
Yeah.
honestly, everyone should be telling their clients and patients about this right away so that we can be the solution for them.
Right. Now, for not the providers, so let's say my fellow burn survivors, my fellow alopecia warriors, I think they go by baldies. If they're interested in reaching out because they want the custom wig,
Mhm.
one of the things that you mentioned in the past when we were chatting, and I definitely want to lean in today, when people come to their shops, for your shops, it's a private experience, right? Like they don't have to worry
Yes.
about someone seeing their spot because I have a friend who has
Mhm.
not shown her natural head in years. Like
Mhm.
her own family didn't even know that she had an alopecia spot. And so you
Yeah,
provide privacy when they're coming to get their hair fitted and tried on, correct?
definitely. It's discreet and private, professional. I wouldn't want anyone staring at my head if I was going through hair loss. And that's what I try to put myself in my client's shoes. You want this experience to be just about you. You really don't need other people's opinion, which is why if you don't want to show your head, you don't have to. In my space, we offer privacy and we're very much about getting you the right solutions. We ask you about your diagnosis, what's going on, and then we can make recommendations for how to get your hair back or just hair loss solutions like the wigs. So even if you're just curious, like, I wonder how I would look with a different look.
Right.
What makes us different is we actually have wigs on hand that you can try blonde, brown, short, straight, curly, whatever it is, and you're able to
Wow.
see and get that experience and being able to touch, feel, and see the hair before making a commitment is what sets us apart from every other wig store.
Wow. Wow. This is
Mhm.
amazing. So, if someone wants to learn more about how they can participate in your discrete services because they want or need a cranial prosthetic, how do they get in touch with you?
Definitely. So through swigs.com, we have a contact form. And then also, if you want to do more informal, we also have like, Instagram, Svelte Wigs, TikTok. That's where you can really see some of the ladies we've transformed. Not everyone lets us record. And trust me, I don't bring out my camera every day.
Right.
But I have some superstar clients that are so comfortable and they believe in our vision so much that they're excited to let us record the process. They want people to see them go from, okay, I had, hair loss. And now within 30 minutes, I'm leaving out with new locks, new hairstyles, new things. So
Amazing.
my superstar clients, they really are advocating for in rooms that I'm not in by talking about me and sharing their experience, but then also sometimes we're allowed to record them and share on our platform. So Svelte Wigs will be where you can find us. And I'll do lives there as well. And I hope to do more online trainings so that you all can get familiar.
That's amazing. So, one of the great pieces we will drop in the comments, the tags. We'll also collaborate with Svelte Wigs. So, you should be
Mhm.
able to see them on this episode of Dr. Shortee Says What. And here's the thing, because everyone isn't going to find a doctor who's aware, and sometimes, even if they're aware, they're not going to be willing to write for it. And you want to know why? Because it's going to take some like kickback. Like, we're going to need an expert like Shadae who can walk you through the process. Because if anyone who's worked in medicine and insurance and authorizations knows it's not always going to be easy. But if you need a doctor who is aware and willing and knows that this is just as essential as when you first had that injury, or as essential as the surgery, or as essential as the chemotherapy that you needed, jointraumaticskin.com is where you can do a consultation with myself, and I will have walked through the training process and know Sade personally, that we can
Yes.
get you connected with the prescriptions and things that you need, in order to start having and feeling good in your skin again. Because the whole purpose of the Traumatic Skin Institute, the whole purpose of the Dr. Shortee Says What, is we want you to feel good in your skin. And so, however and whatever has affected it, we can definitely help you get to feeling like yourself again. So, we look forward to seeing you at booth number 10 if you will be in Charleston at the Southern Region Burn Conference, and or we dropped you and tags in the comments so that you can
Mhm.
reach out to Svelte Wigs, if you yourself are looking for some custom solutions. Sade, thank you so much for joining today, and I look forward to seeing you next week.
All right. See you soon. Thank you so much for having me.
Bye bye.
Bye bye.